good job from the outcome perspective. So people, I want to have the attention of our dear friends here watching us. You solve the case as if it's an MCQ case study. And I will explain in a minute what does it mean. So you gave the right choice, a non-drowsy formulation, which is Claritin, after you did your differential diagnosis and you told me that this is not a flu, this is more towards allergic rhinitis. Great. However, the thought process, which I need my students here, my colleagues here, pharmacists to pay attention to, we need to do it in a little bit different way. Tell me, Anita, what do you think about recommending Benadryl and then I have to tell you that I'm an Uber driver? How did you feel?
I think I should have given you the autonomy at the very first place. Like, is there any preference?
Absolutely. So here, guys, I want you just to pay attention. It's not just giving one of the allergic rhinitis formulation. We have here 3 options. I wanted to start a little bit earlier by telling me that there are 3 options that is not related to allergic rhinitis. They are more related to cold and flu. Advil, Tylenol, and the Nyquil. I will exclude that. First step of the thought process. And then I will go with the 3 options that are more related to our symptoms here. One of them is a drowsy formulation and 2 are non-drowsy formulations. Benadryl, drowsy, and we have the Claritin, Loratadine, and we have the Cetirizine, non-drowsy. $1 million question. If you ask it, it looks much more better in terms of the overall performance and communication that we're looking for. What do you do for a living? And then I will tell you that I'm an Uber driver. So we'll reverse the sequence. You can ask like that, or you can give me the autonomy between drowsy and non-drowsy, but you just need to ask before you make your recommendation. People, if you do it this way, it will show that you are different than the rest of the track, which we need to be, okay? So people, I will go with, what do you do for a living? I'm an Uber driver, I'm a taxi driver, I'm a bus driver, whatever they will answer. Then I will make the exclusion for drowsy formulation and then come to the next step. Before I give Claritin, why did you give Claritin? On what basis? Is there any problem with Cetirizine in your mind?
No, I'm just always more comfortable with Claritin.
You see, guys, Anita is more comfortable, but what about the patient? Where does the patient fit in the decision-making process? So this is the thought process of EDGE. This is how we want the OSCE station to be fully solved. It's not only giving me the right recommendation, it's how did you reach to your decision.
Yeah.
So I hope it's clear for you guys. Before I say Claritin or Cetirizine, I need to give the autonomy. Do you have any preference, sir? I have 2 non-drowsy formulations. Dave, any preference? I will tell you no, whatever you choose. Brilliant. I will pick up whatever. Anything you will pick up after doing this kind of autonomy within the thought process will be correct. And then you give me how many days and so on. Brilliant.
Okay.
So it was brilliant outcome, little bit marginally so from the EDGE perspective and the OSCE parameters for fully solved in terms of your communication and overall performance, which is impacted by your communication as you know. Okay. What I like very much in Anita, when she asked for the triggers, guys, without knowing the trigger of allergic rhinitis, knowing about the puppy that he has, forget it. Give him Claritin the rest of his life. It will not do anything. So you need to tell him that the reason behind that is the puppy that you just got recently. As much as you can, try to wear a mask, try to avoid sitting in the same area for a long time, not to sleep at all in the same bed and so on, which you mentioned in a perfect way. This is an example of an OTC case station that we needed to be fully solved. Don't say, oh, I know this station. This is the allergic rhinitis. How did you know this station? First of all, we never memorize cases because we don't know cases before. Second, I need to go with the flow. People, I need to go with the flow. You went with the flow in a perfect manner, but I want the thought process of EDGE to fit in.
Sure.
Make sense, guys? Make sense, Anita?
Point taken, yes.
Perfect. Then I'm looking for fully solved cases moving ahead.
Let's go.